Hi, I'm Catherine Bertram, Senior Social Behavior Change Advisor with the READY Initiative and Johns Hopkins Center for Communication Programs. I'm here with Geraldine McCrossan of GOAL, who's going to talk about GOAL's community engagement process. Thank you so much, Geraldine. And if you can say a few words to introduce yourself.
Thanks, Catherine. Thank you for the introduction and for the opportunity to discuss GOAL's COVID-19 response. I'm GOAL's Global Health and Social Behaviour Change Policy Advisor and work from Ireland as part of their global HQ COVID-19 response team.
Great, thanks so much. So can you tell us, first of all, tell us a little bit about GOAL's community engagement approach and where it's being implemented?
Community-led action is our main community engagement approach, and is with the aim of having communities do their own risk analysis and trigger sort of collective community action. It's part of a broader community engagement program, the Social Action for Community COVID-19, or SMAC as we call it, that combines the CLA with interactive mass media and engagement of influential leaders. And these are like traditional healers, local chiefs, political leaders, people that sort of can influence the community to take certain actions. And combining this with mass media and the leaders means that we can have a two-way directional communication between the community really and the people who are sort of coordinating the response. And so we just don't have this top-down, one-directional communication channel. This two-way communication channel, it really means then that the concerns of the community are addressed, such as rumors and myths, and also make sure that the communities are a very active part of the response, not just recipients. We're implementing CLA in 12 countries across the Middle East, Africa, and Central America. And initially we did it in our own geographical areas, but we have expanded that. And right now in Sierra Leone, we're supporting the national RCC task force to roll out the CLA in all districts. And I think the fact that the CLA uses participatory learning and action tools allows the community mobilizers that are trained to easily facilitate the discussions with the communities. And it provides a space for communities to really develop their own action plans and their own responses. And what do we see? Action plans, I mean, they would usually include IPC prevention measures at household and community level. There'd be control on who visits the neighborhoods and how we would, how the communities are going to continue engaging with the health service, where they would get testing, how do they obtain food and household essentials if there's a lockdown. So it's a small PLA kit. It only has 3 tools, but they sort of take the community through what are the signs and symptoms, how the community can visualize how the disease spreads in their community, and then they can also visualize where they, as they go about their daily risk, put themselves at risk of getting COVID-19, and therefore that then triggers them to make an action plan.
Yeah, thanks so much for that comprehensive introduction. So I think you've already touched on a lot of this already, but maybe if there's anything that you wanted to add in terms of, what was an important first step you took to engage communities during COVID-19? And if you can tell us in terms of roles, who's leading that engagement at the community level, and what was GOAL's role in this process? And you've touched on the action plans already, but if there's anything else also, if you wanted to mention about the action plans, that would be great.
I mean, a core strength of GOAL's work is always our community engagement. So we, at the beginning of the response, were able to quickly mobilize our existing district and community networks to sort of kickstart and implement the CLA. And we would engage really through the district health and RCE task force for the COVID-19 response. And I suppose to reach communities, but with CLA, we decided to use a remote cascade training approach, like online initially from HQ down to our country health coordinators, and then down to district GOAL staff and Ministry of Health staff. We're also involved, and other partners involved in the training. And then we where possible, we do in-person training of community mobilizers. The mobilizers vary from community health workers to members of village health teams to volunteers who live in the community, and they facilitate the community discussions where they live. So once trained, they can work within their own communities, respecting the COVID-19 restrictions, of course. So the goal, staff don't really enter the community unless absolutely necessary, so that reduces the risk. And the mobilizers are then supported via phone or social media groups. And I think, like many agency, goal has been increasing its ability to support field staff through different digital solutions over the last few months. The reason for trying our best to do in-person training is that these tools are very much visualization tools, and we want to make sure that the mobilizers understand that. And so even when we do in-person trainings, we're sort of incorporating strict COVID-19 prevention measures, including social distancing, hand hygiene, and PPE, and trainings are held outside as much as possible. Our monitoring system has been set up and really to allow us to follow the action plans of communities, so that it can be uploaded through a phone. The data can be transmitted using a mobile device, so sort of reducing the risk. So, center to the whole response is the communities. Yeah. Did I answer that question for you? I didn't.
Yeah, you sure did. Thank you so much for that. Geraldine, can you tell us some of the lessons learned from this experience, from implementing this process, and some of the challenges that you've had and have overcome?
Sorry, Catherine. So, I mean, some of the lessons learned and challenges we've had, and will have been several. I mean, initially we wanted to roll out the CLA quickly. I think a lesson learned for us, for goal from EVD, wasn't that we didn't engage the community and they weren't center the response initially. So on this occasion, we wanted to be sure that happened. So we did roll out the CLA without the sort of interactive mass media and engaging the influential leaders quicker. And what happened really was that there was a lot of misinformation going to the communities, and that wasn't being addressed anywhere. And the communities were really unsure of what actions they should take, and found it difficult to take actions in many places. But where we saw really by June that once we added the two-way directional communication, so that we could address the community's concerns, rumors, and myths, they were starting to respond much quicker and implementing their action plans much faster, and they started to feel very much part of the response. In northern Uganda, they were starting to drive the response, very much showing up at task force meetings and different things. So the district task force was actually quite taken aback that the community were so involved, so that was good. So we're now looking in all countries to make sure that we are implementing CLA as part of, the SMAC approach rather than just calling it CLA, so that the whole community engagement is there. Another lesson we learned is that the CLA process must be very context specific. So the tools do have to be adaptable, and in that way we can implement them in different emergency settings, displaced and refugee camps. And as we go along the process, we're actually expanding the tools in the toolkit. For example, in Sierra Leone, we have now added a PLA tool that assists communities to understand the need for masks and how to use them. And due to the Sierra Leone history with EVD, we have added a tool called Recovery Stories, so the communities can see that in fact with this illness, more people do survive, which helps dispel some of the community fears associated with the COVID-19 infection.
Thank you. Thank you for that. And maybe just to add one more question. If there's one thing that you would like to share with someone coordinating a community engagement response, what would that be?
I suppose I would want to be sure that the community does lead the community engagement process, and that as agencies we don't it's not top down. And I think that we need to become a smaller partner in the community engagement process, so that, like, take for example, in Harare right now, the community action plans were to improve the access to water. So they came to us as a support for that, and we've been able to find local partners who help the community do that. And it's not the usual NGOs going in to solve all the problems. In Malawi, we were able to assist them to redesign their markets and install hand washing, stations. And I think another thing is to, in Zimbabwe, the communities there initially, very early, wanted to split down their communities into neighborhood units, and they did this, and into 15 households, so they could work together. And those neighborhood units have shown us that the community can create a great coherence and a strong motivation to protect small areas, and also actually assist vulnerable people in a much stronger way. So I think we must always understand the community's perspective, and that probably will give us longer lasting results. And that means also then having community engagement approaches that are adaptable to the context, and that there's always a forum for communities to discuss their viewpoint and their concerns, and those are addressed as often as possible.
Yeah. Geraldine, thank you so much for sharing your experiences on Goals Community Engagement Platform. It was really enlightening, and I really appreciate it. Thank you so much.
Thank you so much, Catherine, and thanks again for the opportunity.